Hey guys, my name is Dr. Sam. Now today I'm going to cover everything you need to know about fatty liver disease, particularly what are the common symptoms and treatments for fatty liver. It's a very common condition and there are some important tips that you might not know, so if you keep watching I'll fill you all in. What is fatty liver? Fatty liver disease is a condition where fat builds up in your liver. It is broken up into two main groups: alcoholic fatty liver disease and non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a very common condition. It affects about 20% of people in the world. What does fatty liver do to the body? The presence of extra fat in the liver can cause chronic irritation of the liver cells and subsequently can lead to further liver damage. If it is not treated, this can cause liver failure, liver cancer, and eventually the need for a liver transplant. What causes fatty liver? Alcoholic fatty liver disease only happens in people who are heavy drinkers of alcohol. In non-alcoholic fatty liver disease, there are three common causes: people who are overweight, people who have diabetes, and patients with high cholesterol. Keep in mind that even people who have a normal body weight can still have fatty liver disease. What are the symptoms of fatty liver? Early on, many patients have no symptoms. However, as the inflammation and scarring of the liver happens, people may notice that they feel more tired and have a discomfort in their upper right side of their abdomen. How is fatty liver diagnosed? Your doctor may suspect that you have fatty liver if you get some abnormal liver function blood test results back that were done for another reason. Imaging modalities are usually used to confirm the diagnosis. This can be done with ultrasound, CT scan or MRI scan. Occasionally patients may need a liver biopsy done to work out exactly how much damage has been done to the liver. What are the treatments for fatty liver? Thankfully, fatty liver disease is completely reversible in the early stages. However, there is no specific treatment for fatty liver disease. I usually advise my patients to control their blood sugars and high cholesterol with medications, to lose weight, especially if they are obese. The most important part for patients who have alcoholic-related fatty liver disease is to stop drinking alcohol. What foods should I avoid with fatty liver? Well, it's not all doom and gloom. The most important foods to avoid are foods that are rich in refined sugars, specifically bread, corn, potatoes, and rice. It's also important to eat lean meat and to increase the amounts of salads and vegetables in your diet. What about coffee? If you are a coffee drinker, I have great news. Studies have clearly shown a benefit of drinking coffee in patients who already have liver disease. There have been some suggestions that drinking 2 to 3 cups of coffee per day will prevent liver cancer and liver scarring in patients who already have fatty liver disease.